Imagine this: you've been battling with the unpredictable discomfort of ulcerative colitis, with symptoms that range from mild inconvenience to severe disruption of daily life. And as if that isn't enough, here comes a term that sounds even more daunting: enema. But what if this simple procedure could offer a way to regain some control, or at least clarity, over what's happening in your body? Today, we're going to talk about exactly how enemas fit into the bigger picture of managing ulcerative colitis, UC, why they're recommended, and what you need to know if your doctor suggests this option. Whether you're here because you've heard about barium enemas for diagnosis or mesalamine enemas for treatment, we'll break down everything you need to know, from the benefits to the potential side effects, and even alternatives that might work better for you. Let's start with a quick, relatable truth: UC can be overwhelming. The pain, the frequent trips to the bathroom, the uncertainty. For many, it's a struggle that leaves you wondering when relief will come. That's where treatments like enemas come into play. And no, they're not as scary as they sound. What is an enema, and how does it help with ulcerative colitis? In simple terms, an enema is a procedure where liquid or gas is introduced into the rectum. The goal? To either empty the bowels, take a closer look at the gastrointestinal tract, or deliver medication directly to the inflamed areas of the bowel, which is the case in UC. If you're suffering from UC, your colon and rectum are often inflamed, leading to the frustrating and painful symptoms you experience. But what if we could get medication straight to the source of that inflammation? That's the key benefit of using an enema in this context. Now, let's talk about the different types of enemas used for UC. These typically fall into two categories: diagnostic and treatment-based. Diagnostic enemas, the barium enema. One way doctors diagnose UC, especially when they're trying to assess the extent of inflammation, is through a barium enema. Here's how it works. A radiologist inserts a soft tube into your rectum and fills your bowel with a white liquid called barium. Barium helps create a clearer image of your bowel during an X-ray. This makes it easier for doctors to see any inflammation or abnormalities. If you've been asked to undergo a barium enema, you'll need to prepare by eating light meals, avoiding high-fiber foods, and taking a laxative the day before. It's not the most fun experience, but it's a crucial step toward identifying what's going on inside. The enema itself is relatively quick. You lie on your side, the barium is introduced, and X-rays are taken. While you might feel some discomfort, pain is rare. If you do experience pain, make sure to let your doctor know. That said, barium enemas are becoming less common, with doctors often recommending colonoscopies or CT scans instead. But in certain cases, a barium enema remains a useful tool. Treatment enemas, mesalamine and budesonide. Now, let's move on to what you're probably more interested in: how enemas can treat UC. The two main options are mesalamine and budesonide enemas. These are anti-inflammatory medications that work by reducing the swelling and inflammation in your bowel. Mesalamine enema. Mesalamine is a heavy hitter in the world of UC treatment. It helps by blocking your body's ability to produce the substances that cause inflammation. If you're prescribed a mesalamine enema, here's what to expect. The medication needs to be delivered directly to your bowel, so you'll administer it via an applicator at home. The best time to use this enema is at night, before bed, because you want the medication to stay in your system for about 8 hours. If you're thinking, "I don't know if I can do this," here's some reassurance: the process is straightforward. You lie on your left side, apply a bit of lubricant, and gently insert the applicator. Squeeze the bottle to release the medication, and then stay in the same position for about 30 minutes. The idea is to let the medication settle in and start working its magic. Within days or weeks, most people start feeling relief. But remember, consistency is key. Don't stop using the enema until your doctor says it's okay, even if you start feeling better. Your body needs time to heal fully. Budesonide foam enema. If mesalamine doesn't do the trick, your doctor might suggest budesonide, another anti-inflammatory option. Unlike mesalamine, which is liquid, budesonide comes in a foam form. The application process is pretty similar, but the foam works quickly to cover the inflamed areas in your bowel. A typical dose is 2 milligrams, and it's often used for about 4 to 8 weeks, depending on the severity of your UC. Budesonide can offer rapid relief, but keep in mind that it doesn't cure UC, it simply reduces the inflammation. Side effects and who should avoid these enemas. Every treatment has its side effects, and enemas for UC are no different. With mesalamine, the side effects are usually mild. Some people experience nausea, headaches, or slight discomfort. Budesonide can cause more noticeable side effects like gas, diarrhea, and even rectal pain. Rare, more serious side effects like Cushing's syndrome, think weight gain in unusual areas, or infections can occur, but these are extremely uncommon. Now, who might not be a good candidate for these enemas? If you're pregnant, breastfeeding, or trying to conceive, you'll want to talk to your doctor before using these medications. And if you're taking certain antifungal or HIV medications, there could be drug interactions to consider. Always check with your healthcare provider. Exploring alternatives, steroids, CBD, and natural options. Enemas aren't the only way to manage UC, and some people prefer to explore alternative treatments. Let's take a quick look at a few options. Steroid enemas. Hydrocortisone enemas can activate substances in your skin that reduce redness, itching, and inflammation. While effective, steroids aren't usually the first choice unless other treatments haven't worked. CBD enemas. Cannabidiol, found in cannabis, is being researched for its potential to reduce inflammation in the bowel. However, we still need more evidence before doctors can confidently recommend this option. Coconut oil. Some early studies suggest that coconut oil enemas could help ease colitis symptoms, but again, the research is still in its early stages. Always consult your doctor before trying this at home. Apple cider vinegar. There are claims that an apple cider vinegar enema can help heal the digestive system, but these claims aren't backed by strong scientific evidence just yet. Oral alternatives. Mesalamine and budesonide pills. If performing an enema sounds uncomfortable or just isn't an option for you, both mesalamine and budesonide are available in oral forms, such as tablets or capsules. While these may not be as effective for targeting inflammation in the lower bowel, they're a viable alternative for some people. The takeaway. Here's the big picture. If you're living with ulcerative colitis, there are multiple ways to treat it, and enemas can be a powerful tool, especially for targeting inflammation in the lower bowel. Whether it's a diagnostic barium enema to help figure out what's going on inside, or a treatment enema like mesalamine or budesonide to reduce inflammation, these procedures offer a direct and effective approach. The road to managing UC is often filled with trial and error, but the key is staying informed and discussing all your options with your healthcare provider. While enemas may not be the most glamorous treatment option, they could be a stepping stone toward relief, and that's worth exploring. Thanks for tuning in. If you found this video helpful, don't forget to hit the like button and subscribe for more in-depth, no-nonsense health content. Stay well, and we'll see you in the next video.